Hi, my name is Jane Muir. I am a nurse researcher from the Center for Health Outcomes and Policy Research at the University of Pennsylvania School of Nursing in Philadelphia, Pennsylvania, in the United States. Our research center is a leading organization generating evidence on nurses' work environments and job outcomes, such as burnout, across healthcare settings in the United States and worldwide. I'm also a postdoctoral researcher in the National Clinician Scholars Program at Penn, which is an interdisciplinary fellowship for nurses with PhDs and physician scientists to generate health policy and health services research. My research is really informed by my 6 years of bedside nursing experience in the emergency department setting, and I currently practice as a family nurse practitioner delivering primary care services in Philadelphia. My program of research focuses on how to improve hospital nurse work environments for better patient care quality and safety outcomes, as well as nurse job outcomes such as reduced burnout, job dissatisfaction, and turnover and tension. I'm sure you've heard a lot about issues of clinician burnout since the onset of the pandemic, and research that I work on, and as well as my colleagues in the center where I work in Philadelphia, has really focused on the clinician workforce for over 20 years. My research spans a range of topics from a broad lens of nurses, such as looking at why they ended healthcare employment in recent years, to more specific issues like focusing on care in the emergency department context. Today, I'll be sharing with you a research article entitled "The Association of the Emergency Department Nurse Work Environment on Patient Care and Nurse Job Outcomes," published September 28, 2023 in the Journal of the American College of Emergency Physicians Open. The objective of the study was to determine the relationship between the emergency department nurse work environment and patient care quality and safety and nurse job outcomes, specifically nurse burnout, job dissatisfaction, and intent to leave the employer. The funding for this work was supported by the National Institutes of Nursing Research and the National Council of State Boards of Nursing in the United States. This was a cross-sectional study using reports from emergency nurses who completed a survey called the RN Forecast New York-Illinois Survey. And this was administered to nurses working in New York and Illinois hospitals between April and June 2021. In this survey, nurses reported on the characteristics of their hospital, the quality and safety of patient care, and the quality of their work environment using a National Quality Forum endorsed measure called the Practice Environment Scale of the Nursing Work Index. This measure asks nurses to rate aspects of nurse staffing on their unit, the leadership ability of their employer, nurses' involvement in decision-making on their unit and hospital affairs, and interprofessional collaboration. Nurses also answered questions on their job satisfaction, turnover intentions, and burnout using the Maslach inventory in the survey. We used generalized estimating equations to determine the relationship between the emergency nurse work environment and nurse-reported patient care quality and safety and nurse job outcomes. We had both unadjusted models and adjusted models controlling for covariates such as emergency department patient volume, technology status of hospitals, as well as individual nurse characteristics. Our final sample included 746 nurses employed in 221 hospital emergency departments in New York and Illinois. We found that 58% of emergency nurses reported high burnout, 39% reported job dissatisfaction, and 27% indicated an intent to leave their employer in the next year. We found that nurses working in better compared to mixed and mixed compared to poor emergency department work environments were 65% less likely to report poor patient care quality outcomes and 79% less likely to give their hospital a poor patient safety grade. We also found that nurses were 61% less likely to report high burnout, 58% less likely to report job dissatisfaction, and 49% less likely to report turnover and tension when working in better compared to mixed work environments and mixed compared to poor work environments. Our findings demonstrate that solutions to improve patient care quality and safety, as well as to avoid expensive nursing outcomes for hospitals like burnout and turnover, should focus on leveraging the nurse work environment, specifically looking at supporting nurse staffing, at ensuring that staffing is sufficient in healthcare units, specifically in emergency departments where the care is highly variable and uncertain, allowing nurses to be involved in the decision-making that happens on their unit, and leveraging interprofessional collaborations on healthcare units. Our findings support existing literature validating that the top cited intervention that nurses rate that would improve their job outcomes such as burnout, things that would reduce their burnout, the top cited reason that these nurses report is to improve nurse staffing on healthcare units. I hope that you've enjoyed this research brief. Please feel free to reach out to me at janemuir@upenn.edu, JaneMuir@upenn.edu. Thank you.